needs of the elderly persons and person with disabilities. Some of the agencies classifies their elderly as 60 or older. It provides transportation to those individuals that does not have access to public transportation. The agencies that are eligible to apply for that program are a nonprofit 501c3 program, and they must have a transportation program for more than a year to qualify. The 5311 Rural Public Transportation Program, it provides transportation for on-demand response in the rural and small urban areas, basically like a city bus transportation. They can go anywhere to like a doctor's appointment, shopping, school, employment, anything you could think of. That's what the 5311 program is for. Then we have the 5316, which is the Job Access Reverse Commute Program. This provides transportation services to individuals who are welfare recipients and other low-income persons to jobs and other employment-related services. We currently have about 37 general public transit providers which fall under the 5311 program, and about over close to 70-something 5310 agencies. Well, let me back up. Louisiana has a transit providers guide. So with that guide, you can actually go in there and see all the transportation agencies that we have provided that we're actually funding under those grants. I will provide the link in the chat shortly if you want to have access to that. It provides who the director is, the contact information, what services they provided, if they're open or closed transportation services or an on-demand response service. And if you want to ask any questions to those directors, you can contact them directly. Their number and also their email address will be provided on the Louisiana Transit Resource Guide. The agencies actually update their information in the Transit Resource Guide every year. The beginning of each fiscal year, they're required to go in and update the information. Sometimes we do tend to have a turnover with directors, but not too often. If anyone is interested in these programs, you can actually go to our DOTD Public Transit website, click on LA Team Online Application. It actually went live last Monday, July 13th. You can submit your application. The deadline is actually November 1st of 2020. For anyone that's new, you have what if you're applying for 5311, you have the whole year to apply. You don't have to wait to rush and meet the deadline for November 1st. All our current agencies, they are required to submit their applications by November 1st. We also provide training and support to our agencies, which is through the RTAP program, where we actually fund for those agencies to have training for their drivers, such as if they need to go and do a driver training or they have anything that they need for their drivers, we provide that. We actually go through our MPOs to provide those services and pay for it out of our federal funds. The current updates for our agencies, currently majority of our 5311 agencies are open. Some of them are open and some are closed. It varies every week due to the COVID. If they have a staff member or any clients that has gotten the COVID virus, then they are shut down for at least 2 weeks until further notice. Right now, some are providing limited services to doctor's appointments and essential needs only. And then majority of our 5310s, they're currently closed due to the COVID-19. I think we have like a handful that's either providing limited services for the ones that are working in their actual facilities that they have available, and some that are not operating at all. And that's pretty much my update for DOTD on our transit system.
Thank you, Stephanie. Would you mind staying on and seeing if there's any questions that may be asked for the department?
Sure.
Appreciate it.
You're welcome.
Okay, great. Now that DOTD has presented, I'm going to ask Mr. Jonathan Bolen to share his presentation.
And Jamar, there is one question from chat. I'm going to put it in here and you can answer, let her answer whenever you're ready.
Okay, thank you so much.
Hi, everybody. Yes, I'd like to go ahead and follow up on what Stephanie was saying and take you down from a state level to a regional level. So I represent RAPC and the Alexandria Pineville Metropolitan Planning Organization. So RAPC operates in partnership with DOTD, a program known as Coordinated Human Service Transportation for each region. So the regions typically mirror the LDH regions. So LDH Region 6 is the region that we administer for our Human Services Coordinated Transportation Program. So every 2 years, part of what we do, we work with the 5310, 5311, and 5307 transportation agencies and human service agencies. Our job is to really interface and bring them at the table so we can hear the concerns from the human service agencies about the needs or transportation challenges that their clients may be facing and the transportation providers who offer that service. And the idea is to connect the two together and to discuss whatever issue that may come out just through communication and coordination. So, you know, in our region, we have 4 agencies that are 5310s that serve disabled, and we only have 3 5311 agencies. There's one in Vernon, one in Rapides, and one in Boyles. Some parishes in our region are completely underserved by transportation, such as Grant Parish, for example. There's no transportation program for 5310 that's elderly or disabled or for rural general public transportation itself. So we have huge gaps in the regions that we've been working to address through these coordinated efforts. Of course, we're limited in terms of funding and capability as to what we can do as an agency, a planning agency, but our goals again are to try to connect agencies to the transportation providers themselves. And from that dialogue, we've identified several different issues that we've been working to address. The first of which was just resource awareness. A lot of the human service agencies in our region, not all the time, but sometimes we'll have periods of frequent turnover in staff. And every time we have new caseworkers that come in, they need to be acclimated to the available transportation resources that we have. And so to piggyback off of what the DOTD had started with their transportation resource guide, we had taken one and started to develop that for our region. And that guide was a tool, had 2 purposes. First of which was to communicate and convey to the public what is out there and what's available in terms of transportation. And then secondly, for those human service agencies and caseworkers who are trying to coordinate those client trips for just general, any purpose type of transportation, from non-emergency medical to everyday errands. Many of our transportation agencies, especially those who are 5310 that work as ARCs or associations for persons with developmental disabilities, they do a lot of transportation for job sites. So every year, what we tend to do, we have 4 quarterly coordination meetings. We have 1 big regional workshop every 2 years where we bring our policy legislators, our other officials at the table to communicate to them what the needs and challenges are in their areas facing transportation. In other words, it's all about promoting awareness, resources that are available, things that we need to continue to enhance regional mobility for residents in their areas. And then every year we like to touch base with our transportation providers. We tend to either make a in-person, I mean, you would call it a site visit, but it's not necessarily that. We'd call it just a visit. We like to go in and touch base with our providers and hear from them what their challenges are. And what we tend to do is that after you meet with all the transportation providers in the region, you identify several common issues that may be facing certain providers. And that was one such issue that we uncovered with surrounding the single consolidated waiver that was coming down the pipeline originally for 2020, now at 2021. We had transportation providers that interface at the 5310 level that really had some questions about how the new single consolidated waiver would affect their transportation programs, would affect their operations, would affect having to transport their clients. And so that was one of the things that was first brought to attention in our region just through this outreach. The next step was to sit down and discuss with DOTD and other relevant stakeholders, our local LDH regional office and our regional, the Central Louisiana Human Services District, on what the challenges are facing transportation providers, not just with the single consolidated waiver, but other issues such as funding. We wanted to also identify common successes, in other words, solutions that other agencies are doing, such as fundraising efforts to help boost that local match for those transportation-related grants that Stephanie had mentioned for 5310 or 5311. And we want to continue to put resources into the tools resource tools into the hands of our transportation agencies so they can go out and lobby support, more local support for their transportation programs and efforts. So, you know, following again off of what Stephanie was saying, many of our agencies due to COVID are either not operating or operating with limited service. And it varies from agency to agency based off of the individual staff's needs and the capabilities or capacities that that agency may have right now. So we have some agencies, again, that are ranging from shuttered to just providing transportation to job sites or program-related transportation only. So the transportation landscape in the region right now is certainly affected by the pandemic. But if we were to go to pre-COVID, we were fortunate enough to have the resources that we do in our region. But what we're trying to focus on now is enhancing regional mobility for LDH Region 6. And so a couple of projects that we're working on as a planning commission is researching the feasibility and business model development for an RTA to implement that in the region. So we have our human service agency providers, our 5310s, our 5311. We have our intercity bus service, which would be a Greyhound. Although limited, we do have it, but we are missing the regional transportation element connecting parishes and cities together within our region. And so that's the next big thing that we're hoping to work on right now. But again, our primary function through the Human Services Coordinated Transportation Program and the Central Louisiana Coordinated Transportation Coalition is to connect the dots, to take the folks that operate the system and folks that use the system and the folks that administer and govern the system, sit them down at the table to address the issues through coordination and communication. And that's pretty much it for what we do here at our shop for Region 6.
Thank you, Jonathan. And we'll come back and I'm sure that there's some questions that our attendees will have. Mark, we're going to ask you to come on and give your presentation.
Hey, good afternoon, everybody. So my name is Mark Raymond Jr. I serve as the Vice Chair for the Regional Transit Authority. I've been on the board now for nearly 2 years, and I was appointed by the mayor to really represent the disabled community and see what enhancements we could make based off of feedback from someone who actually used the service. So a lot of my initial thoughts came from my experience prior to being a board member, which were, poor performance on on-time pickups, which would a lot of times would make me late for doctor's appointments. And then on the back end, I would have to wait for a vehicle to return to pick me up. So it was just a very inefficient process. And a lot of what we've been pushing the Regional Transit Authority to do is modernize our technology and our approach, i.e. using Uber-like software to help do a much quicker booking for these individual trips. So we're moving on that. We actually received grant funding to do a pilot program in New Orleans East that would do that effectively, it would be more like an on-demand transit option for paratransit. So miles from where we were 2 years ago. But we've also put a huge focus on our people approach, how we engage with customers. Another big problem that I always faced was long wait times when I would call to schedule my trips. So we've reduced that number from an average of 5 minutes to under 1 minute. And I think the next big problem that we need to tackle as a transit agency is the discrimination that we still practice on the majority of our transit options, i.e., first of all, the St. Charles streetcar line is for the most part inaccessible. And we had an ADA lawsuit brought by Mr. Andy Beiser to help address some of that. And the change that came out of it, or the settlement, was that we would put 2 accessible streetcars on the route, and they would be able to drop off at 6 stops out of the 52 stops. So if I wanted to use the St. Charles streetcar to go to a restaurant, I would have to pick one of these 6 stops to get off at, which could be anywhere from 1 mile to 2 miles from where I actually want to go, which is a huge problem. It's a huge discrimination. So the board, led by some of my direction, has asked the CEO to conduct a feasibility study on what it would require to make all of our transit options completely accessible in the city of New Orleans. I have this theory that we should be a world-class transit providing city. And in order to do that, we can't discriminate on people. We can't turn down disabled people, and we really need to have a universally accessible system. And another big thing that we've been pushing is connectivity with the rest of the state and parishes, and how do we have a bigger voice for commuter rail and that level of connectivity. So I'm really excited for what the future holds for Louisiana, and I'm excited to be a member of GACTA and co-chair for the Transportation Committee. I look forward to doing all of this great work alongside some of my esteemed colleagues. And if anyone has any questions for me, I'm here to answer them.
Okay, great. And thank you all for presenting today. And if we can, we do have some questions, and we would like to use the remaining time as possibly like a Q&A session to talk about various things, such as how groups, local entities, such as Rapides and the New Orleans area, can effectively give advice to other cities, towns, other jurisdictions in our state to work on transportation, or just building a network to address transportation concerns and mobilizing efforts to improve things. Is there anyone that wants to speak on that particular topic?
Jamar, can you repeat that question and also ask all the panelists to start their cameras?
Yes. Did everybody hear Bambi? You can start your cameras and take yourselves off mute. I would like the panelists to share, particularly Mark and Jonathan, to share some ideas of how local entities, within the state, cities, towns can build their own transportation initiatives to address and try to resolve some of the shortcomings of transportation for their local areas. And y'all can take turns sharing your thoughts of how to build it. And I know, Jonathan, that you probably have more more experience in this regard. So if you want to go first,
Absolutely,
take it
Jamal.
on.
The first piece of advice I'd give to anybody is that, there's somebody like me in each region of the state. So in each region of the state, DOTD has a coordinated human services transportation program that is administered through their MPO office. So I would, first of all, recommend them to reach out to their local MPO, their Metropolitan Planning Organization. In Lake Charles, let's see, Shreveport, that will be the Northwest Louisiana Council of Governments. Central Louisiana is RAPC. We have the Capital Area Planning Commission in Baton Rouge, the Acadian Planning Commission in Lafayette, MCAL, which is in Lake Charles, and then we have South Central Planning Commission, and there's another one. Stephanie, what's the one I'm missing? The New Orleans region. Is that RPC, the Regional Planning Commission? Yeah. So each one of those agencies I mentioned, there is my counterpart, the Human Services Transportation Program Coordinator. I would start with DOTD and get their information, or reach out to that MPO, just do a quick Google search, find that MPO, find that program, and go to the table and sit with them and start coordinating. The program each year has basically a coordinated plan that it updates every 2 years, and that's where you want to have that discussion between, identifying first of all what transportation resources you would have available, and then working with that group and other community stakeholders to take it to the next level, to expand and develop that transportation system, just like what you just heard down there with RTA in New Orleans, where they get feedback, they are responsive, so they're going out and trying to improve the accessibility and the connectivity of their system. But for us, we're at the regional level, and we really focus mostly on coordination. So for any agency out there, if you're looking to find out what resources are available, assistance for grant opportunities, especially the DOTD grant opportunities for 5310 and 5311 assistance, your MPO would be a great place to start. And that program is, again, a great way to sit down and to work with not only your other transportation stakeholders who are at the table, but ideally other community stakeholders, other groups throughout the community, and your political figures to actually have some teeth behind whatever you guys come out with. So, more importantly, for any agency that's looking to sustain a program, you've got to have that funding in place. You've got to have your local support. You've got to have that local match if you're going to go out, especially start expanding your transportation program using grant resources. They all require, most of them, unless you're lucky to sit in on CARES Act funding right now with 100% federal share, most of these programs require a local share, a fund match, 50% for operating, 25% for capital. I think it's 15 or 20% if you're looking to buy a bus that has a wheelchair lift. But again, you have to have that local fund match to not just get the equipment for the capital purchase, but to sustain operations. And coming to the table, letting them hear you, making yourself heard, and then hearing from them what those issues are, the challenges facing your region, is a great start. We've had some folks that come to the table for the first time. Our major medical centers, both of them are in Alexandria. We had them sitting at the table for the first time with our rural transit public providers, which they were unaware of. And we were talking about discharging patients from the major medical centers to areas that were outside of the available transit system. They were discharging patients on ambulances. Little did they know until they were at the table that there's a rural parish public provider that can provide that same trip for a fraction of the cost. So that's just a sample of the information that you can come across just by coming to the table and participating at those quarterly Human Service Transportation Coalition meetings.
Great.
That's all I have. That's the first step. Do I have any other questions or anything I can
We
answer?
want to move to the next question.
So, Jamar, are you having difficulty with your sound?
Okay, y'all able to hear me?
Yeah, I can hear you now.
Okay, thanks. Mark, is there anything you wanted to add to what Jonathan had to contribute?
No, I think Jonathan summed that up beautifully.
Okay. All right, great. We do have a question in the chat, presumably for DOTD, and anyone is at liberty to answer who knows the answer. The question is there transportation for people with disabilities to and from college if they have health challenges that impose health issues to ride the public bus? So I think the question was the first half of it is, are there transportation for individuals with disabilities to go to college who may have some health challenges?
We do have transportation available, but it's not just to say that that agency is going to provide transportation only to that individual just to go to college and back and forth. As far as 5311, it is a public body. It serves the public, so anybody can ride the vehicles to go anywhere. 5310 is just for elderly and disabled clients. Those clients they have to go through a specialized, some agencies actually have where you have to apply through their 5310 program to get qualified so they can provide transportation service to you all. However, if you don't qualify, there are other agencies probably in that area that you can go through to see if they can provide those type of transportations to you. But to say that we're going to have a transportation provider that only provides services to that one person that has a disability to and from college for that one trip is not going to be like that. For 5311 is really like a public city type transportation. Is on demand. You schedule your transportation that you need for that day, and then that agency provider actually puts you on with other clients. So you're not riding that by yourself. So the trip might not be specifically for just to go to college. You can be ride with someone that has to go to a doctor's appointment, someone that has to go shopping. So it's not going just to that actual university or college to drop off someone.
Yeah, and I'll follow up with that. In our region, if you are somebody who is looking for a disabled transportation provider, you have to first go to the Central Louisiana Human Services District and get a waiver. You have to get on that waiting list, and those waivers are there's only so many waivers that are available, and they're prioritized based off of need. So, there's a chance that, you can go in and you qualify and you get a waiver, and you could be eligible for that service provided by that disabled 5310 provider for that. And the only other option, like Stephanie said, was that if available, you could get a rural transit provider call and schedule a ride in advance and have them, bring you to and from campus. We're trying to work on this in our region with our local community technical college. We have a system, Central Louisiana is very rural, very agrarian, a lot of spatial gaps, a lot of temporal gaps as far as trying to put a service together and operate that. So we have a technical community college system that has 6 campuses spread out throughout the region. The newest one is in downtown Alexandria. And we did a commuter survey with them. And one of the things that we identified were in previous years, we had rural providers that actually had contracts with those campuses to provide transportation service for their student populations. There was agreement between the school and the provider itself. But again, if you're looking for specialized transportation, it has to start with the waiver for that provider. So we've had cases before COVID where we've had disabled providers in our region that have the capability, the space, the capacity to handle more folks, but they would be limited based off of the waivers that they could receive from the Human Services District or that were allotted at that time. So it is a challenge in our region, but again, start there. And if you don't have any luck, move to contacting your rural public transit provider. And that's not to say that in your region, you may have some type of specialized nonprofit that's out there that's under the radar. But typically for the programs that we administer or work and coordinate with, they're working with DOTD through 5310, 5311, or your small urban transit system, which would be 5307. We aspire to get to where they are with the RTA in New Orleans and other parts of the state. That's where we want to be. But you know, to serve those specialized needs that are out there. But we've got to lay the groundwork first before we can build it. So that's Central Louisiana.
This is Bambi. Can I ask a question for clarification, Jonathan? You talked about waiver, and I mean, there's so many different waivers whenever you're dealing with disability systems. What waiver specifically are you talking about?
Well, that's when it gets into the weeds for me.
Is it a waiver through the developmental disability waiver?
Yes.
Okay, so like a now waiver or supports waiver?
Yes, and so there's
Okay.
now, there's supports waiver, and that's what kind of started the discussion when we were doing our outreach for the new single consolidated waiver.
Right.
Everybody on the LDH side was hearing about it's coming down the pipeline, but in the DOTD side, we didn't really know because we're only interfacing with FTA DOTD programs and not Medicare, Medicaid, LDH necessarily. You know, there are trips where they interface, and these two providers, you know, you'll have one provider that's operating at 5310, 5311, and serving as a Medicaid provider as well. So we would be hearing this from one provider about these different issues. And then when we sat down and we identified it, we said, okay, it comes down to these waivers that are coming out. And then, you know, again, the big issue with the new single consolidated supports waiver, how is that going to affect transportation service? What transportation trips would, what's going to be considered an eligible transportation expense under that, so on and so forth. But just for clarification's sake, those would be the waivers that I was referring to, the ones that are administered through your human services districts.
Thank you.
And also, as far as the New Orleans metro area, anyone looking to go to school can utilize the paratransit service if you have a disability.
All right, thank you. There is a question from Mark, and I think you're the appropriate person to answer this from our chat. Why is it that accessibility on the streetcars is such a difficult task to accomplish since they are funded by public monies and many streetcars have been put in service in recent years?
Well, the initial streetcar line, the St. Charles line specifically wasn't designed before it was designed well before the ADA. And then it became a National Historic Monument. So there's just a lot of red tape that we have to get around when it comes to that conversation. And the cars themselves are historically designated. Not to say that that historical designation should ever trump ADA or functionality. That's the biggest problem I have, but those are the arguments that have been previously made. Now, the new lines, the Canal Street line is completely accessible. The Rampart Street line is completely accessible. And the cars on the lines themselves are accessible as well. The biggest issue is just the St. Charles line. I hope I answered that question sufficiently.
For some reason, I'm getting muted. Yeah, and I do realize that some of the designations are troublesome, like, and not only for transportation, but the accessibility of buildings who have the historical tag. But it's a shame that people of all walks of life can't enjoy their features and as intended. There is a question, and I think this is appropriate for all three of our panelists. Is there transportation providers who are fluent in ASL and other languages for ELL individuals with disabilities? And if I get clarification on the acronym, that would be great.
That's English language learners.
Okay, thank you.
With our 5311 and 5310 programs, they are required to have an LEP policy where they coordinate with their local EIL companies or anyone that can translate for them. So they are required by FTA and DOTD to have a policy in place where if they were to have any clients that are riding with them or associated with them and need assistance, to communicate through them.
All right, thank you.
I was going to say that pretty much every agency that applies for DOTD or FTA assistance is required to have a Title VI plan. In that plan, they would have their ESL or LEP policy in there. So it depends on the agency. They're all required to have it, but how they do it's a little different. Some use apps. Some may have the benefit of having bilingual staff on hand. But again, there is some mechanism that is required in place for each agency that at least receives public money.
And at this time, are there any updates or any projects, programs that your respective agencies are working on that our panel, that our participants may want to, that you want to share?
Just for me, in the mission of advancing regional mobility, we have the RTA study, and that's something that we're just getting off the ground. When we start to do our public outreach, it's going to be rather robust and include not just members of the general public, but also human service agency. I mean, it's very robust, but that's a project that I think, at least for Central Louisiana, is going to be important to addressing those mobility gaps. And the other project we have on the inner ring of our area, we're looking at, we're currently conducting a study on our urban transit system that's been conducted in 30 years. Because we know that although maybe that transportation system hasn't moved in 30 years, population groups have certainly shifted, and the cities have moved and changed in the meantime. So we're really trying to conduct a systemic overhaul, or analysis first, and then an overhaul of mobility in the whole area, first focusing on urban and then the regional. So those are the two most exciting projects that we have right now. Unfortunately, they're planning projects, but a necessary first step to getting it done.
This is Bambi. I have a question or maybe just a comment from Mark. Mark, you're now one of the co-chairs for our transportation committee for the Governor's Advisory Council on Disability Affairs. And it seems like to have Jonathan and his counterparts across the state to participate in that might be helpful in kind of moving things forward. I don't know if any of you have any comments or thoughts about that.
That's exactly what I was sitting here thinking about when it comes to, so right now the RTA is undertaking a standpoint to be more, have a larger presence in the region, i.e. we solely operate pretty much in Orleans Parish, which leaves out our residents in St. Bernard and then connecting Jefferson Parish. There's just not enough fluent connectivity between our New Orleans metro area and more broadly throughout the state. So how do we develop a bigger coalition of transit agencies to provide these services? And I think that's critical. So I would say, yeah, I would love to have more conversations with Jonathan about, little things that we can start to do to implement and work towards this bigger change and bigger goal.
Jonathan, you're muted.
I'd happy to be a part of it. Anytime you guys have any questions or need any input, I'd be happy to share my perspective on what we're doing in our region with you guys. I noticed there was another question here that was talking about simple paving and accessible curbing. How could that be? It says simple paving and accessible curbing should be easily accomplished. It's all easily accomplished if you just coordinate and get at the table and start programming these projects. There are great funding opportunities that come out on an annual basis. However, you may find yourselves like we did in our region where, great, is an awesome funding opportunity, but we don't have the plan in hand to go out and obtain the funding. We can write a grant, but we don't know what we want to fund. We don't have a plan in hand. So what we're doing now, we're putting a plan together. There's a great program out there that's 5339. It's the FTA designation for cities and transit agencies, but that's buses and bus facilities. That's pretty much, I think, 2 years ago, the last time I did the project like that. That's fixing infrastructure, sidewalks, streetscapes, ADA, everything around that bus stop by up to half a mile in some cases. So, you know, you have programs out there, but you have grant opportunities out there. But coming to the table and talking about what those problems are, identifying them, and then putting a plan together, then you can go out and fund and implement those changes. A lot of people, this is again my perspective, a lot of people think that, you know, government has this omnipresent view about everything that's going on in every single piece of time. But the folks that, for example, in their neighborhoods that walk those sidewalks every day, that drive those streets every day, that operate, live, work, commute in and out of those areas every day, they know that area better than somebody else that's coming around every quarter or once a month or twice a year. And those are the people that need to be heard and brought to the table, and their input needs to not only be gathered, but that's when you can start making a plan of action to go out and address those problems. But it starts again with communication and coordination.
I would like to second that. And for the New Orleans metro area, it's prioritizing which streets and sidewalks need to be done and getting them in the queue quickly. Because unfortunately, with anything that has to go through that much bureaucracy, it's just going to take time. And Jonathan, to your point, the sooner we start that planning process, the better the quicker it'll get done. But there is monies earmarked for that, to your point.
Yeah, and that's right, Mark. And the other part of it is when it comes down to funding, local funding, the more local match you have, let's say if you had all the local funding to do the program and you didn't need a grant, you can implement that project as fast as you want. But when you have to use federal funding and you have to use partner agencies, it takes a little bit more time. It takes a lot of patience. But it's the slow way. If you have the money to do it yourself, go out and do it yourself. If you don't, and you have to get a local match together, you gotta have to sit down and work with the other agencies, and people just need to understand that these things take time. But more importantly, you have to bring them up to our attention, and we have to know them. And again, I keep coming back to it, and I'm gonna stop. But it's coordinating and coming to the table is the first step. First step.
Okay, thank you. Let's see. Is this a comment or a question that I'm looking at? Jefferson Parish has it in their plan to make all curbing accessible. They recurb often, especially as other work is done. So I think that's a comment. So that's positive to hear.
And there's a question above that one.
Okay. What do we have?
Do we have any opportunities in the works with expanding transportation services in the rural areas?
Just the planning study that we've mentioned right now for our region in Central Louisiana. we are always trying to plug human service agencies and other stakeholders into our public 5311, our rural public transit providers. We always have an issue of empty seats, but we always have demand for rides. And so really that comes down to people coordinating and getting these trips. Utilizing what we have is step one, because if we can't keep those providers, you know, that represents an even larger challenge for the region. But as far as our plans, first, it stays at just trying to maximize what we have. We have 3 providers, one in the Vernon, Rapides, and Avoyelles. We try to maximize those as much as possible. They go to other parishes sometimes, not to pick up trips, but they'll take somebody from Vernon Parish, for example, to a doctor's appointment in New Orleans or Shreveport or Baton Rouge or wherever. These folks travel all over the place. But again, we have parishes in our region that have nothing. And there is no program. There is no senior transportation program. There is no disabled transportation program. There is no public rural transportation program. And so what we're trying to do in those areas is we're trying to identify nonprofits that are under our radar that are doing this service. And so that's one other step that you can go out and find them. And then if they're qualified 501c3 or certified nonprofit, you want to then work with them to build their transportation program to where they're eligible to apply for 5311 assistance or 5310 assistance. But at the same time, that's all we can do right now in our region to expand rural mobility. Again, we've got the study underway on how we want to roll out our RTA in central Louisiana. But for the time being, what do we do? So we're trying to maximize what we have and identify other players that we can bring to the table, build them up to make them bona fide, certified, rural public transit providers, and potentially partners for the MPA moving forward.
I have a question for Stephanie. Stephanie, where can we find the information of the providers of those grants, the 5310 and 5311?
To find the current providers, it's called Louisiana Transit Resource Guide. I provided in the link in the chat. Are you able to see it?
Okay, I didn't know. See, I'm asking and you thought about it before. So
I've uploaded in the chat the access to go directly to the application and also direct access to our provider's guide.
okay, very good. Thank you.
You're welcome.
And Melanie, can you transfer that link over to our YouTube so the people on YouTube can get that link? Well, it's 2 different links.
Sure, and there are a few other questions here, Jamar, if you wanted to go through those.
Okay, great. All right, I do see a very good question, and it's relative to rideshare. Are there opportunities currently for public-private partnerships with entities like Uber and Lyft to expand transit and paratransit operations for individuals with disabilities?
Yes, there are opportunities. I will say, RTA is currently exploring those partnerships specifically with Uber and Lyft, but they do exist in other municipalities around the country. Uber specifically has a lot of partnerships to do last mile pickups and supplemental paratransit pickups when necessary. We just haven't engaged in that conversation yet.
I would love to participate in engagement of those conversations to help move things forward if that's what we need. And I think that's something that the GACTA Transportation Committee would certainly most be interested in helping if that's what's needed. If there's more advocacy, if there's more whatever needs to be done. I'm 100% sure that the Transportation Committee and other advocates similarly situated will gladly participate in helping in that. So if there's information to be shared about how to engage rideshare companies, please, we could talk offline about that. So I think that's the missing piece to our puzzle in trying to expand the opportunities as the question came about. I see we have roughly 20 minutes. Are there any additional comments from our panelists or closing remarks that you would like to share with our participants?
I'd just like to remind everyone about our application process. It is up and open, and anybody that's interested in applying, if you're a new agency or provider that you're interested in the 5311 or 5310 or 5316 program, just go on the link that I provided in the chat. Just keep in mind, if you're a new agency, you have more up to a year to apply. Current agencies, they have to apply, and the deadline is November 1st. And to make sure that they go to our resource guide, they want to see all the agencies that we have providing services to their different areas in Louisiana.
Mark, you want to go?
Sure. I was just gonna say, anybody who is in the New Orleans metro area and needs paratransit services, you can visit norta.com to get any information and to get the application to fill out. It's pretty quick and simple. I think they even offer to pick you up from your home and bring you to RTA to take care of your identification card. And anybody who needs to access me, you can email me at mraymond@rtaforward.org.
And I'll follow up and say, for the regional perspective, please take a moment to plug in with your local MPO, your regional metropolitan planning organization, and reach out to that point of contact for their human services transportation program. If anything, to touch base with them, and then whenever we start resuming quarterly meetings, have quarterly meetings, come to the meetings and participate, because you're going to find out a lot of information, but that's also how you can communicate what those needs that you're experiencing at your agency with your clients to those transit providers and the other folks at the table.
I'm sorry, can you hear me?
Yes.
Okay, great. I would like to thank our panelists for taking time to participate in this session. I think some great information has been shared, and we look forward to working with everyone moving forward as we try to work on our concerns and improve our transportation in our state. So with that being said, we're going to end this session a little early, and we will begin our next session, which is voting accessibility, which features Michelle Bishop and Jamie Duplichin at 3:30.
Jamar, this is Bambi. We'll start back at 3:15. I want to do an introduction of our staff at that time. And so if everyone could just get back here at 3:15, we'll do that and then move into that last session. Thank you, guys. Appreciate it. Great session.
Thank you for having us.